For those of you who have attended some of our programs before, you know that Dr. Taylor Rush and I work on a lot of projects together to hopefully improve the quality of life of those affected by Parkinson's disease. Therefore, I am really happy to get to introduce Dr. Rush to those of you who have never had the pleasure of listening to her speak before. Dr. Rush received her PhD in clinical health psychology from East Carolina University. She completed her internship in health psychology at the University of Florida, and then did a 2-year fellowship in health psychology at the Cleveland Clinic. She has been on staff with us at the Cleveland Clinic since 2015 and divides her time between working with patients with movement disorders, chronic pain, and headache on integrated care teams where her expertise is highly valued. Thank you, Dr. Rush, for being with us today.
Hello, everyone. I am so grateful to be here with you all today and to be able to share some ideas and maybe some new ways of thinking about some things. I am Taylor Rush. I am a clinical health psychologist in our Center for Neurological Restoration at the Cleveland Clinic. And a big part of my practice and what I do is working with folks as well as families who are dealing with Parkinson's. And I will say that, in psychology, we end up focusing on a lot of negative things. We focus on depression, we focus on anxiety. We talk about things in terms of deficits, what's missing, what's not going well. And sometimes I think we don't always highlight and kind of expand on things that are strengths, things that are positives. And I think especially in the past year and a half that we've had, which has been intense, I think that our screeners for looking at negative things has heightened a bit. So I thought that today maybe we would talk about things that were a little bit more on the positive range and ways to be able to expand on those. So our talk today is compassion and laughter, Leaven for well-being. So as you can see here, this is a delicious loaf of bread. And as most of you know, one key ingredient to making bread look, smell, and taste the way that it does is to add yeast. Yeast helps the dough to rise, and it brings flavor and smells to bread that make it so irresistible and delicious. And so we call yeast a leavening agent. And this is where we usually hear that term leaven. And sometimes when I use it, people kind of look at me weird because they think I'm talking about yeast. When in fact, leaven goes beyond that. Leaven is a pervasive influence that changes something for the better. And I think for all of us, we need things in our lives that leaven our experiences, that leaven the quality of our lives. And so I would just ask you to take a brief moment and think about, what is your leaven? For some people, it may be specific, special relationships that they have with loved ones. It might be activities in which they engage that bring them joy. And for others, it may be being in particular places, destinations that just kind of nourish their soul. And so today we're going to talk about 2 different possible influences for making one's life better, and that is compassion and laughter. So let's begin by talking about compassion. Compassion comes from the Latin word compati, which basically means to suffer together. And I think that sometimes people misinterpret compassion as empathy. And so that's the idea of being able to identify and understand someone's emotional experience. But compassion actually goes beyond that. It's empathy plus action, recognizing when one sees suffering and then being able to act upon that in order to make the situation better. And we actually know that compassion is part of our makeup. It's part of what makes us human. It's part of our core. And there's actually been a ton of research on compassion that has shown that our first impulse is to help others, not to help ourselves. We are socially connected and we need that. And to help others often means that we do help ourselves. We know that compassion has a whole range of health benefits, both mentally as well as physically. It enhances our sense of connection to others. It can actually bolster our resilience in really difficult circumstances. And it also helps to foster creative thinking, ways in which we can address, difficult situations in new or novel ways. And it actually, in terms of our physical health, it's been demonstrated that people who show compassionate tendencies recover more quickly from acute illnesses. Their longevity is actually extended. They show less chronic inflammatory markers. And so there are actually quite a few health benefits towards helping others. And it also helps with our mental health. We also have found in different research that giving to others actually stimulates the reward center in our brain more than receiving help, receiving kindness. And so we end up wanting to do this because it makes us feel good. And it makes us feel more purposeful. And it makes us feel perhaps we, in some small way, are creating a better place in this world. And so I like this quote by Bob Carey that says, "Unexpected kindness is the most powerful, least costly, and most underrated agent of human change." Now, let's talk a little bit about self-compassion, because I think this is where some people really tend to get stuck. And so when I bring up the idea of self-compassion with the patients that I work with, I almost get this visceral reaction from them like, ooh, I don't know about that. Self-compassion, that's not really something I'm comfortable with. And this is again and again and again a reaction that I see. And so it kind of begs the question, why is self-compassion so darn difficult? Why do we have such a hard time stomaching this idea? And so there are a few reasons. One is we may hold a double standard of what we expect from ourselves versus what we perceive others doing or should be doing or want to be doing. And we tend to be much kinder towards other individuals than we are ourselves. Well, I should have known better. I shouldn't have done that. If they do that, that's okay. It might have been a matter of circumstance or situation, but for me, if I didn't do things the way that I wanted to, then perhaps it's because there's something inherently wrong with me. So I need to just buck up. And that kind of leads into this next point of fear of complacency, that some people will express that if I'm nice to myself, I might slack off and I may not get stuff done. And I may not, get, towards my goals because I'll just kind of say, oh, it's okay, no big deal. I will say I've yet to see that actually happen, that when people engage in self-compassion, it actually ends up making them more productive and they get more done because they don't have the kind of strangling anxiety of messing up hovering over them. Self-compassion also means that one has to be a bit vulnerable. It means that you have to recognize that, hey, I'm human, I make mistakes. It's kind of part of our genetic makeup. We're inherently flawed, and it's okay. And it also means that we see ourselves as deserving. And so I really like this graphic down here that talks about kind of the three universal factors for self-compassion is being kind towards oneself, recognizing that we are part of humanity, again, that's inherently flawed, and being mindful, which means being present in a moment without necessarily judging harshly what is going on in that moment. So some ideas for practicing compassion, either towards yourself or others. And so one thing that I will often challenge my patients to do is, if your friend or your loved one were in a situation that you're describing that's stressful and that you are really berating yourself for, what would you tell them? And often it's a much kinder comment than they give themselves. And so I asked them, what would it be like to actually turn that around and give yourself the encouragement that you would to someone else? What is it that you would say to them that you don't see yourself worthy of hearing? And for many people, that's a very uncomfortable process, but ends up also being very powerful. Engaging in self-care. And self-care, we hear that term all the time, and it can mean many, many different things. For some people, self-care might be, crafting. For some people, self-care might be getting in 8 glasses of water a day because they normally don't. For other people, self-care is preserving an adequate amount of sleep at night. But engaging in any act that could be construed as a kindness towards the self, there's an underlying message that means you're worthy of your own time. And I think we all need to send that message to ourselves on a daily basis in a few different ways. And then in terms of compassion towards others, I find that when my patients participate in some sort of collective effort of purpose, that might be volunteering, that might be assisting a family member in some way, either emotionally, logistically, financially, whatever it may be, but doing something that goes beyond the self and helping someone towards a greater good, that often helps them feel better. And I will say in the past year and a half, my patients that were very involved in volunteering have lamented how much they have terribly, terribly missed it, because many of those volunteer opportunities have shut down, but are now hopefully starting to reopen a bit. And of all the things that they missed from the world as we knew it in 2019, volunteering and being part of those communities was definitely ranking pretty high. And then practicing small acts of kindness. Sometimes you hear about, at Starbucks, the person in line pays for the next person, and then it ends up being this chain event. And so even something small, small acts of kindness that people aren't expecting, things that just show our humanity and show that we care, go such a long way. And so finding opportunities for that, kind of putting the filter on of what can I do today for myself, and what can I potentially do for others to make that day just maybe an inch better. So now let's talk a little bit about laughter. And I want you just to take a brief moment and think about the last time you had a really good laugh, like a full-on belly laugh. I know for me, my husband will show me different videos that he sees online. He follows all that stuff on Twitter and TikTok and things like that. And he showed me this video of a seagull, and it was set to this specific music. And I don't know why, but it just struck me as hilarious. And I must have watched that thing 10 times over. And every time it produced that same laughter. And, it was ridiculous. It was random, but it really kind of helped set the tone for the rest of my evening. And so it's amazing what, spontaneous laughter can do for us. And we start laughing at such a young age. Babies can start laughing in response to environmental stimuli at about 2 months. And, it serves to communicate joy, excitement, happiness. And so it's very much a part of our emotional expression as humans, and oftentimes ends up being something we end up doing less and less as we get older. I think in part because maybe we take ourselves too seriously, or feel like it's, not conforming to social expectations, but laughter can be an incredibly helpful and important part to our quality of life. And so we know that there are actually many physical as well as emotional benefits to laughter. It's a stress buster. We see cortisol, which is a stress hormone, go down in people who laugh often. And we think that it's because of that people actually have a more robust immune response to illness. It also means that people feel a bit sharper in terms of memory and concentration. When we laugh, it's, most often it's not alone. Sometimes it is. But a lot of times laughter occurs in the midst of social interactions. And so it helps to enhance that connection. And I remember reading a quote one time that said, laughter is the universal language and requires no interpretation. Laughter is also a mood booster. It helps to raise endorphins. It raises dopamine levels. And because of some of that, it actually aids in pain reduction. And so many people will report less in pain as a result of laughter because of those chemical shifts that are occurring in the body and in the brain. So let's talk a little bit about laughter and Parkinson's disease. There are actually some pretty impressive studies that have happened in regards to this. So there was one study that was done that looked at patients with Parkinson's that engaged in laughter yoga. And yes, that is a real thing. Laughter yoga is basically where one kind of intentionally tries to simulate laughter. So you're laughing on purpose. And that may sound kind of forced, but interestingly, it ends up kind of causing the same physiologic response as spontaneous laughter. And it also helps to oxygenate the brain and the body better because we're breathing much more deeply. And so what they found is that after laughter yoga, individuals rated their well-being as higher. I mean, if you think about sitting and purposefully trying to laugh and, having someone else do that in front of you too, it ends up feeling really ridiculous and absurd, and you're going to start laughing spontaneously as a result of it. And so, it seems to kind of kick the ball to get started down the hill. There was also another really interesting study by Bega and colleagues on improv. And so they actually had patients, people with Parkinson's, attend a 12-week set of improv sessions. So improv, is basically, this spontaneous, unscripted interaction between people based on maybe a prompt or a topic that's given. And people play off of each other and they kind of make up a story or make up a scene as they go. And it's a lot of yes, and. So I'm walking down the street and I see a dog. Yes, and then, walking further down the street, there's another dog and they start, fist fighting. Like, who knows? But you play off of each other and it brings a sense of interest and novelty because you don't know what's going to happen next. And as a result, you kind of can't take yourself all that seriously. And with that, it helps to kind of let loose. And people end up being able to laugh. And at the end of that 12 weeks, I think it was really impressive that no one's actually quit. Usually in studies, we see people stop. No one quit in that study. And at the end, not only did they report improved well-being, but they actually had better motor scores than when they came in. So I think some commonalities with that is that you're able to join with others. It's more, these types of activities are communal. They're different, they're novel. There's something that sparks interest in the brain that allows you to think about these kinds of activities in a different way. And doing laughter yoga or improv, I think, kind of sheds one's inhibitions. And you can just be, you can play. And I don't think that we always recognize the importance and utility of that, especially as the serious grown-ups that we are. How to add laughter. It seems like a weird thing because you just think it happens, but a lot of times there are ways that we can kind of set the stage for it. So surrounding yourself with others who laugh often. We do know that laughter is contagious after all. And watching things that promote happiness and laughter, TV, movies, other programming that kind of, strikes you as funny. That helps, even in that laughter, physiologically, the benefit is the same. Reading things that are funny. And I think so often we kind of get hooked into the shock value of TV, of all the negative things that are reported on an hour-by-hour basis on 24-hour news cycles. Let's steer away from that, because that definitely does not promote happiness, laughter, and has actually been shown to exacerbate depression quite a bit. So add some funny things in there. There's actually something called humor journaling. And that's where, kind of like gratitude journaling, you write down, 1 to 3 funny things that happen that day. And then lastly, taking yourself less seriously. We're human. We're not meant to be automaton robots that do everything right all the time. It ends up being really burdensome and really stiff. Let loose. Allow yourself to relax. Laugh. So a few key take-home points. So purposeful positivity makes a difference. So we can't passively expect these things to happen. We have to actively pursue positive change by finding ways to incorporate things such as compassion and laughter in our lives. And I think it's important to recognize, we can't always choose our circumstances. There are many factors of life that are outside of our active control. But we can choose our intentions. We can choose how we decide to navigate those situations, how we take care of ourselves, how we interpret pieces of data that we get from day-to-day life. And whether we find things that end up striking our funny bone, or finding ways that we can make our own lives or someone else's lives better. Let's take those opportunities as they arise. So going back to our initial loaf of bread here, I would just ask you to now think, after hearing some of these things, what will your leaven be? There may be some things that remain the same, but with this information, I'm hoping that I can bring to you a little bit of spark to brainstorm some new ideas to enhance your life, your well-being, your connections. So thank you very much for listening. And again, I'm grateful to be with you today, and would welcome any and all questions before, during, and after this program. Thank you.